Now, for medical news, the FDA has approved a new inhalable insulin drug. According to the Centers for Disease Control and Prevention, an estimated 29 million Americans suffer from diabetes. Here with this medical news and some more is Dr. Cheruba Prabakar. She is a OB/GYN at Maimonides Medical Center. Dr. Prabakar, good to see you.
Thank you.
Thanks so much for being here. This sounds like it could really be good news. There's, as we said, 29 million sufferers with diabetes. And this inhalable drug has some unique properties that are different than injectable. So let's talk about what is the difference and why it might be better.
Sure. This is actually great news for our patients suffering with diabetes. Those with diabetes who need insulin are having to be burdened with taking their injections and their syringes around and having to inject themselves about 20 minutes prior to their meals. And with the new inhalable form that comes essentially in an inhaler pump, it's more discreet, it's more convenient, and what we hope is really it's going to lead to greater compliance and better medication adherence, which is great news.
In terms of how the drug performs, how the insulin performs when it is taken in this manner, does it perform any differently, better, any faster?
Absolutely. It actually shows that it controls the levels of sugar in your blood much better. A study of over 3,000 patients showed that it's better compared to the injectable form.
Are there particular sufferers that are best suited for the inhalable insulin?
Not particularly, but those who smoke or have any chronic lung disease cannot use it.
Ah, okay. Any risk or side effects that we should know about?
Well, there are several that everybody should consult their doctor about, but nothing, very obvious at this time.
As I understand it, this is not the first inhalable insulin, which I was surprised to learn as I was getting ready for our conversation. What happened to the first version?
So about 7 years ago, Pfizer came up with an inhalable insulin as well. But that particular medication did not perform any better compared to the injectable form. So it didn't really have great sales. But this one, the studies have shown that it does perform better. So we hope that more people can use it and control their diabetes better.
A lot of optimism around it.
Absolutely.
Okay, let's turn to another thing. And this sounds very promising, too, and that's for those who need organ transplant. There's a technique of supercooling an organ that might make it available, organ transplant, for more patients and under different circumstances. Tell us a little bit about this technology first.
So typically, organ transplantation has a time limit of over 24 hours from when a donor has to, take that organ and give it to a recipient. So as you can imagine, this puts a great strain on where and how far you can carry this organ. So a lab out of Mass General Hospital in Boston has come up with this technology that involves various solvents as well as cooling these organs to about 20 degrees Fahrenheit and prolonging this time that they survive outside the body to up to 4 days. So this is great news because we can take these organs across the country and really around the world and provide organs to those who need it.
And this technology is appropriate for which organs?
Right now, the studies have been done on rat livers, but they're going to transform to human livers and other human organs like the heart, the kidney, and the eyes. Wow. Right now, there are 17,000 patients who are on the liver transplant list in the United States, so this is good news for them.
This could be really good news. Yeah. I have a little cousin who needs a kidney transplant, and I can just imagine how that would change the situation for him. Let's move on very quickly. We literally just have a few seconds left. Talk about, we've been hearing in the news about this increase of calls to poison control because kids are getting a hold to liquid nicotine.
Right. So we're in July, and there have been over 70 calls already to poison control because the liquid nicotine in cartridges have been inhaled by children. So we hope that the caps will have better safety measures in the future.
There needs to be warnings on those. Way to wrap that up. Thank you, Dr. Cheruba Prabakar.
No problem.
We do appreciate it.
That's
going to do it for us today. Thanks for joining us. We'll see you tomorrow for another edition of Arise America. Bye-bye.